fixing to find out. Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Pastor Jimmy Roberts, I think. Is Pastor Roberts here? Okay, so we'll still have a prayer. Will you bow with me, please? Dear Lord, we thank you for this many blessings which you have bestowed upon each and every one of us. We ask your special blessing during this time as we fight this COVID-19 virus. Be with each one of us as we go about our ways and go about what we're doing. Let it be pleasing in your sight, for it's in your Son's name that I pray. Amen. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Mr. Manius?
Thank you, Your Honor. Members, before we have a discussion on the agenda first, as we've been doing for the last couple of weeks, we're going to take our briefing item that deals with emerging health issues and bring that forward so up the front when we get to the administrator section. That way we can cover all of the COVID-related issues in one setting. Also, under the administrator section, item A2, this is discussion possible action concerning activities. We sent you a document yesterday. We are going to have 2 action items on that particular section. You should have gotten some information on that yesterday, and we'll talk about it again before we ask you to take a vote today. Thank you, Your Honor.
Thank you. Court members, you have before you the minutes of our regular meeting of April the 14th.
Move for approval.
Second. We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously. Proclamations, Commissioner Fickus?
Yes. We have a proclamation for National Volunteer Week, and this is let me open this up here, and I think a very appropriate proclamation for all the different organizations who have been involved in our coronavirus efforts here the past 6 weeks. And so let me start off. Whereas during National Volunteer Week, we acknowledge the many Americans who generously give their time and talents to help improve the life of others. And whereas nationally, 1 out of 4 Americans volunteer, 2 out of 3 Americans help their neighbors, and these acts of kindness help build a better and brighter future and remind us that we all have a role to play in making our community safer, healthier, and stronger. And whereas the commitment to serving others has always contributed to the success and prosperity of our nation. And whereas this week we pay tribute to both our county and country's volunteers and recognize every American who takes the time to help others. And whereas we celebrate the spirit and generosity that drive our citizens to care for others and serve a cause greater than themselves, especially during the time we currently face as a nation with the COVID-19 pandemic. And now therefore be resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim the week of April 19th through the 25th, 2020 as National Volunteer Week in Tarrant County and call upon all citizens to join us in this special observance, in witness whereof we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 21st day of April 2020. Move approval.
I will
Second.
We have a motion and a second. We'll now vote. Commissioner Brooks,
Most appropriate, yes.
Commissioner Fickus,
Yes.
Commissioner Johnson,
Yes.
Commissioner Allen,
Yes.
and Judge Whitley votes yes. Motion passes unanimously. Court members, you have before you our consent agenda.
Move approval of the consent agenda.
Second.
We have a motion and a second to approve the consent agenda. Commissioner Brooks,
Yes.
Commissioner Allen,
No.
Commissioner Fickus. Is there something you'd like pulled off there?
Yes, and GK's looking into it.
Okay.
So let us pull at least one item off the agenda, so off the consent agenda. And that would be item number J7, which is the North Point Compass classification software application for discussion purposes.
Okay. So we are going to, I'm going to ask that we just stop, and Commissioner Fickus, you made the
Yes.
motion.
I will remake that motion and approve the consent agenda with removing items from purchasing. Is that correct?
That's correct, J7.
J7.
I second.
So we have a motion and a second. Commissioner Brooks,
Yes.
Commissioner Allen,
Yes.
Commissioner Fickus,
Yes.
Commissioner Johnson,
Yes.
and Judge Whitley votes yes. Motion passes unanimously. Public hearings. We have two public hearings today. Patricia, would you like to come forward for those, I believe?
Good morning. We have two public hearings today. The first is to request the Commissioners Court conduct a public hearing to Amendment Number 1 to the 3-year consolidated plan beginning in July. That consists of allowing us to use CDBG dollars for infectious disease and testing and social services and medical services surrounding the coronavirus. If you would open the public hearing now, I'd appreciate it.
This time I'll open the public hearing and ask if anyone is here wishing to speak to this matter. There appearing to be none, then I'll close the public hearing at this time.
No, not today. We will come back to the court and ask you to approve the consolidated plan to be submitted to HUD. The second public hearing is to allow us to reallocate $300,000 from housing rehab to public services to address what was allowable under the first public hearing, which would be testing, diagnosis, and other services to provide meals to quarantine individuals that need to maintain social distancing due to medical issues.
I will open the public hearing at this time and ask if anyone is here wishing to speak to this matter. There appearing to be none, then I will close the public hearing at this time.
Thank you very much.
Thank you. Okay, Mr. Manius.
Your Honor, if we can now go. If we can now go to the briefing item as it relates to health issues, and I'm going to ask Dr. Tanasia to come forward, and we'll begin that process.
Good morning, Your Honor, members of the court. We'll go over our COVID-19 situation awareness update again. With global case counts, if I can get the dashboard up on the screen. So for this morning, we're about, let's see if we can refresh that data. Sometimes they do an update and it hasn't been refreshed. I think we're at about 2.5 million ballpark on those total number of global cases. And if you look at total number of U.S. cases, we're at about 789,000 almost. If you click on, so worldwide that's 171,000. And they've started to show some testing data for the United States. 4 million or so tests conducted for the U.S. And New York has had the highest, 633,000, but Texas is number 4 at about 190,000 or so. If you click on that U.S. number on the left under confirmed cases, it gets you a little bit more detail. Let's see if it updates. One more. Oh, there we go. And so 789,000 or so cases, 42,000 deaths. What I usually point out on my daily briefings sometimes is that the number of deaths occurring in the U.S., a lot of them have occurred, almost 1/3 have occurred in New York. New York City alone has 14,000 or so deaths, and then another 1,300 or so in New York State. Wayne County, Michigan, Detroit area is a third in the entire country, number 3 of about 1,100 or so cases. So that's kind of the highlights. And one of the things that we've always been asked, and if we can go to the Texas dashboard, there's 190,000 or so tests that have been conducted in Texas, and about 19,000 or so have now tested as positive cases. So if you do the math, ballpark, we're hovering around 10% positivity. And that's been that way for quite a while. I mean, it's fluctuated a little up and down. So a lot of times there's questions about, well, how many people have been tested in your county or your city? So based on that, I can tell you, you just multiply your number of positive cases by 10, and that should give you a good estimation on where you are on any given day. Because a lot of this data is now starting to come from DSHS on a weekly basis. But if somebody needs a quick math, that's a good way to do it. 495 or so reported cases, or deaths for all of Texas. And then I'm looking at my numbers for this morning. 1,333, I believe, is going to be our number for Tarrant County today. We had a little bit of a data glitch over the weekend. DSHS had been working on upgrading their NEDS surveillance system, where we get a lot of our laboratory reports. So the spigot had been turned off over the weekend, and we only had a handful of cases. And yesterday, about 80 or so came in. So now we have 1,300 and some change for the entire county. We're going to report, I believe, at least 3 more deaths this morning.
Do we have that report?
No, that update's like around in the afternoon, around midday, when all the data cleanup has occurred and everything's ready to post. So I'm just giving you all a preview on what's going to be coming on the dashboard for Tarrant County. So that's where we are with our numbers. If we can go back to the PowerPoint, unless you had any questions.
I would like to see the slide, if we could, from the counties, because as I recall, we had 116 that were actually in the hospital as of yesterday.
Yes, sir. That's the county dashboard. If you could bring that up. Okay, and if you could go to full screen and then go to the hospital capacity dashboard, which is 6th or 7th tab right there. All right. Okay, and is that what you were looking for, sir?
Okay, and that was as of yesterday, so 123 actually in the hospital, and then available beds were about a little bit 2629.
Yes, sir.
Okay. Yes.
And there's 685 available ventilators also, Judge.
And always for clarification, this 123 are people that are confirmed with COVID-19 in hospital beds in Tarrant County. They're not necessarily all Tarrant County residents. I mean, you have to assume we're a large metro county. Now, bulk could be ours, but I'm sure there's a few that are other county residents in there.
But I think the important thing to remember is when we started all this out, again, we were concerned that we didn't want to come anywhere near where New York was, where their hospitals were closed, they were overrun by COVID-19, they had no beds available for the other segments of the population who needed hospitalization at that time.
Yes, sir.
And so that was the reason we really began asking our citizens to practice some of the social distancing and those types of things. And I think it's important to show that that's been successful.
Yes, sir. Yes, sir. We have about almost half, 48% of our hospital bed capacity is available for use, whatever illness that may be. Yes, sir. Okay. Anything else on our data dashboard that you all would like to see or talk about?
I want to compliment you on that dashboard because as I've looked at other sites, this is very clear, and I really like the way you put that together.
Well, thank you, and thank you all for asking the questions, because a lot of this was you guys asking and then us trying to find where that information is. So it's a collaborative effort. If people don't ask, sometimes you don't think about what people may want to see.
Is this the hospital capacity? Try the case characteristics for a second. Yeah, that one. That hospitalization status up there in the top.
Yes, sir.
How can ever hospitalized age 65 and above be 25% and non-hospitalized age 65 only being 9%?
Right. So yes, that is a little confusing to look at. I know you asked that question yesterday, so I have staff clarify that for us. So the real data here to look at is between ever hospitalized and not hospitalized. That's 100%. 35% were ever hospitalized and 65% were never hospitalized out of the cases that are reported here. And out of those, now there's a subgroup. So people that were ever hospitalized, out of those, 25% were over 65 age group. So people that had a hospital stay related to COVID-19, about 25% of those folks were 65.
25% of the 35%.
Yes, sir.
Okay, and then 9% of the 65.
Yes, sir. There you go.
So what it says is just as we've said from the very beginning,
Senior
the
age
folks
group
that we've really got to be careful for are the ones that are 65 plus and underlying health conditions.
Yes, sir.
So on that slide, Doctor, when we say ever hospitalized, that could be an individual like the first one we had. They were hospitalized for a day and a half. That
Correct.
doesn't mean that they stayed in through the entire
Yes, sir. That is absolutely correct. This is on their history if they were ever admitted to a hospital related to COVID-19. It could be as short as 1 day, because that happened in several of the cases. They were admitted, and then later they were released to go home and recover, in 1 or 2 days. And some of them have had a longer stay, and as you know, there's been some deaths, and a lot of those do occur in hospitals, and they've had a long stay where they did not recover. And ended up dying. So it's kind of a range, but a lot of these people have just been released to go home because they were, sick enough at the time of admission, then they got better to be released to go home and recuperate on their own.
We also, Dr. Tanajan, I know you've mentioned this multiple times, but it seems like the question has come up again pretty recently. I think even as recent as maybe a call we were on yesterday about the number of recoveries and why they seem so low.
Well, and again,
in terms of the numbers that we're reporting.
Yes.
Yeah.
So the real issue there is the recovery data is really not reportable by law. So what we report on is people that we've been talking to and have sought clearance through public health, saying my employer is asking, or if we thought that they were a critical function worker like a healthcare provider that we've been really particularly worried about, that we don't want you to go back without getting a clearance from us, things like that. So again, because recoveries are not reportable by law, we're never really going to see, okay, we had 1,300 cases and 1,300 recovered. At some point you can assume that, they're recovered, but really it's never really going to match up. I mean, that's happening worldwide. If you look at that data is always going to be lagging, and there's going to be huge gaps because recovery, just think about any illness. You go to the doctor, you get the flu, and then you come back home and you recover. You don't really call anybody other than maybe going back to work saying, oh, well, I recovered from the flu. But you don't really report it to public health. You don't report it to the doctor, things like that. So recoveries are generally not reportable. We find them because situations happen. People need a letter either from public health or their own physician. And a lot of times the physician just say, okay, you're ready to go back to work, and we don't really ever see that. So that's the reality.
Well, and then earlier in your report, I know you had mentioned, talked about the hospital bed and ventilator capacity, and to the judge's point, we have seen success. I would just add so far, I want to be really careful not to give our community a false sense of security. I don't want to alarm them, but at the same time, we need to reinforce things that they should continue doing so that we could achieve that continued success. So can you just reinforce what people need to continue doing?
Absolutely, and it's part of my slides too, but really the messaging stays the same, that we need to listen to our leadership and follow the orders that are in place already and the new ones that we're going to put out and so forth. But the message for now is stay at home. You don't need to be out unless you're you're running a critical function for either for your work or your family. So that's the main message. And then when you are out, the guidance has been, and it's not a requirement right now, but the guidance has been that you should wear a face mask of some kind. A cloth-based face covering is what CDC recommended, because that's a good balance on when you're going to be out, how do you reduce the risk. And then all the other common sense things that we've been talking about since flu season and now with COVID-19, maintain good hygiene, cover your cough and sneezes in your sleeve, wash your hands throughout the day, and really if you're sick, definitely stay home. You don't need to be out, and if you are seriously ill, go seek health care at that point. So those are really the main messages, and I think they fall in line with what we've been saying, and we just need to reinforce those pretty much every day.
Thank you.
Judge, I have a question, please.
Okay.
Dr. Taneja, with 83 new cases reported yesterday, I think it's fairly safe to assume that we have not yet peaked in Tarrant County. My question is, how will we know when we have peaked? What will be the indicators of that?
That's a good question, Commissioner. So there's several ways to look at it, but one of the easiest ways is actually what our federal plan on reopening America was starting to put those gating criteria. And if you look at those, one of the indicators in there was looking at your number of cases reported, that they should be on a downward trend for the last 14 days. That's a good indicator that you're on a decline part of the curve. So in retrospect, you can identify, okay, there was a peak, and that's how we see that in the flu season too. You really never are able to tell when you're at the top, but when you're starting to come down from the top and some data has gone by, oh, well, that was one peak that we have reached and now we're on a downward curve. So that's one way to look at it. And the other way they said, well, if you still have an increasing number of cases, but your positivity rate starts to decline over the last 14 days. So we've been hovering around at 10%. Let's say that positivity rate starts to decline. That might be another indicator that you've kind of gone past a peak in the cases. And the reason I keep saying a peak is because there's been a lot of this discussion about, are we going to see multiple peaks in this, because that happens time to time with illnesses like this. So for now, we're going to hope and pray that we only see that one peak, and that's the only peak. But really, when we start to see a consistent decline and downward trend, that's when you identify that you've been past the peak.
We are about to get into a period of more and more accessible testing. Do you predict, as a result of wider testing, that our positivity rate will continue to be 10%?
That I don't know, sir. It can have a lot of different impacts. When you test more people, you're obviously going to find more cases, but percentage-wise, it's hard for me to say. It depends on how the disease is progressing in the community. If you cast a wider net, you're going to find more people, so the raw numbers may be up, but the percentage may be flat or maybe declining. It just remains to be seen how it actually plays out.
How will that affect the peaking?
So, like I said again, if we show that we're either on a downward trend for 14 days for, total number of cases, that would be one obvious way. Or the other way would be that if the testing volume has either remained flat or has gone up, but the percentage positive has been coming down for the last 14 days, that would be a good indicator that we have peaked.
Thank you.
Commissioner, I'll just say this kind of around those questions. I think that what we're looking for, and I go back to kind of what I may have said earlier. I've said it a couple times today, but I'm not sure I've said it in here. When we started this, when we began to put the restrictions in place, we put them in place to make sure that we did not fill up our hospitals to the point to where they had to close. I think we've been very successful at that. Now, I'm not saying that it's now the time to relax and throw everything open, but I do definitely believe that we need to begin on as Mr. Manius and I were talking this morning, almost as a parallel track. We've got the economy, we've got business, and we've got health. And we have been focused primarily, if not almost exclusively, on the health track. And I think what we've seen, and the goal there was to make sure that we kept the hospitals open. And we have done that, and we've done it very successfully. I think now we've got to begin to at least discuss and think about how we open the business back up, the new ways that we will operate those businesses in an effort to make sure that we don't, reignite the spread of this virus. But again, the goal is not to fill up the hospitals. We have, I think our flu cases this year are, going to be in the millions. The deaths by flu are going to be, 60 to 70,000 deaths. I know we still do not have a vaccine for this, and I know that we still must be very careful with our older adults, as we just showed, with our older adults and folks with underlying health issues. But I do think that as we move toward lessening the restrictions, we're still going to see positive cases. I think we're still going to see some times in there when it may be an increase in positive cases. But the thing that I think we must maintain focus on is whether and how those cases and how those positive cases are affecting our hospital bed availability. And that's the thing we need to always stay keeping our radar as we move forward and as we begin. Now is not the time to relax. I think we're still at least 2 to 3 weeks, maybe 4 weeks away from beginning to lessen the restrictions. To some extent, the governor did that effective tonight, and our order that we're going to talk about in a few moments will do the same. And so those are the kind of things that we need to be aware of. But we're pretty much staying in step with the governor. But we are at the same time beginning to look down the road to when we can really lessen the restrictions and begin to put the different sectors of the economy back to work. And I think that's very important. It's not going to be just the cases. The thing that we need to focus on and remember is the reason we did all this was the availability of beds in our hospitals.
Judge, I agree with most everything that you said. It's a very delicate balancing act between protecting the health of our citizens and protecting the health of the economy. Not overloading our hospital beds is one indicator of success. I think another essential indicator is what we find out in increased testing. We've got to be more aggressive with our testing so we'll know about the health of our citizens. At the same time, that we're considering the health of the economy.
I agree with you, Commissioner Brooks.
All right. If I may get back to the slides, and actually, I want to kind of share what my thoughts were, and they're right in line with what you all were discussing. So just to kind of cover the slides first, though, this is just a U.S. situational awareness map. Of course, Texas has 10,000 or more cases, so we're in the deeper browns here, and we've covered some of the data. But here's exactly what you all were discussing. So what should we do next? Well, first reminder is let's stay the course. Like you said, we're not there yet, so let's not everybody just relax. And stay at home is the best policy for everybody right now. That if you're critical function, either providing something for your family or doing something for work, we understand. But everybody else really just needs to stay home and follow the executive orders as they're issued. But what we all should be doing is really taking the time to understand what the federal plan has been about opening up America again, and then wait for the governor's plan to come out and look at what really fits the needs of Tarrant County. And this is a good time for us to all review that, not only as leadership for the county, but for the county's residents too, because they're going to be asked to follow some guidance. And when they read these documents, they're very easy to understand. I mean, they're not very complicated. They're written in simple language because it is a very phased approach. They have certain very clear criteria. Okay, this must happen in your community, and then you go to the next phase. So I encourage everybody to read them and be prepared. That way you've got some knowledge. And of course there's going to be tweaks that are made for Texas and tweaks that are made for Tarrant County. That's absolutely fine. We'll work on that. But this is the time to really read those and understand those. Until then, stay the course. And then the takeaway message is, like I said earlier, listen to our leaders and take action today. We, again, must all work together, even though it's kind of an oxymoron, social distance with each other, but work together. But really, we need to be working together about practicing social distancing, wearing a mask in public, and staying home as much as possible. Again, I want to remind our community is very, very resilient. We will get through this. And with that, I'll open up for any other questions. All right, thank you.
Thanks.
I've got some audience participation and says COVID-19 impact. I'm not sure. That looks like it's A2 and A1, so I'm not sure. Since that was the briefing item, I think we're okay. And then we have some comments regarding items that are not. We got a couple of items that are not on the agenda, so. Okay, so GK, go ahead, and then we'll.
So we can go to item 1 under the administrator section. This is a very broad topic or in a court communication that deals with the local disaster declarations that we've done in the past, and Your Honor, some of the executive orders that you have listed or have issued in the past. I know that you just mentioned that you wanted to talk to the court about a pending new order that you might want to issue. If that's your purpose, well, then this would be the appropriate time to talk about that.
Okay, I think we may have just passed out to y'all the order, and it is highlighted in yellow. Basically, what we're, as a result of the governor issuing opinions number 1516. Do you?
I don't have it.
Tell me one. I'm sorry. I
think I got it.
I apologize. And I understand for those of y'all, for Commissioner Brooks and Commissioner Johnson, that you don't have this, and for that I apologize. Basically, what we are doing with changing this executive order at this point in time is bringing this in line in compliance with the governor's orders that were passed, that he actually put out on Friday, that go into effect at 11:59 tonight. And item 8 is changed to basically, what it had previously said was a public or private gathering of any number of people occurring outside a single household or living unit are prohibited except as otherwise provided herein. Nothing in this executive order prohibits the gathering of members of a household or living unit, nor does it prohibit any gathering expressly permitted in Order GA 14. And then what we're deleting, or what we're adding is, instead of, we're not deleting anything, we're adding, or any subsequent order by Governor Abbott. So that just basically says in the future we're not going to have to amend the order as he changes that particular part of it. Number 9 had previously, let me see if I can figure out what we previously said. I think I may have left that. No, here it is. It's item 9. Item 9 had previously said all elective surgical and dental procedures are prohibited anywhere in Tarrant County. All licensed healthcare professionals shall postpone all surgeries, procedures that are not immediately medically necessary to correct a serious medical condition of or to preserve the life of a patient who, without immediate performance of the surgery or procedure, would be at risk for serious adverse medical consequences or death as determined by the patient's physicians, provided, however, that this prohibition shall not apply to any procedure that, if performed in accordance with the commonly accepted standard of clinical practice, would not deplete the hospital's capacity or the personal protective equipment needed to cope with the COVID-19 disaster. So that's what it did say, and what I'm proposing is, again, very closely mirroring what the governor saying is licensed healthcare professionals and all licensed healthcare facilities shall refer to Governor Abbott's executive order GA 15 for direction on permissible activities. So again, it's basically using the same criteria that the governor has in there.
Glenn, I have just a question, and I'm not sure it even matters here, but I recognize that all, or at least the vast majority of healthcare professionals are licensed, but they are licensed. But are all healthcare facilities licensed? The actual facility, is there a license required if you are a dentist or if you are a physician and you have a clinic and you and 5 nurses and your staff, and is there an actual license other than a city occupancy permit? Is there some state license for that facility to operate other than the license required by the professionals that are within that building?
I can only speculate, which normally will get me in trouble, and probably will this time too. That my guess is that a licensed facility is going to be one that's going to be doing surgeries, or that there may be some form of anesthesia, something along that line. So it could go down to the dentist's office from a standpoint that you sometimes are providing painkillers, or you may be putting someone under in order to extract or to do work within that practice. But, I know your surgery centers are licensed, and then your hospitals are certainly licensed from that standpoint. Anybody else has any other knowledge? Now would be the time to rise.
Or does it depend on if it's in Colleyville?
Well, if it's in Colleyville, certainly you can do whatever you want to do. Page 3 of my existing order talks about, at the bottom of page 3, it begins a conversation about essential businesses. And under essential businesses, the first one is essential healthcare services. And the change that I am making to that particular paragraph is at the end of that paragraph, I am deleting health care operations do not include elective medical, surgical, and dental procedures as established in accordance with this executive order. So again, what that does is it allows us to be in line with what the governor is allowing and to give some flexibility there. In that same area, under item double I, or two, no, excuse me, it's 3, under essential critical infrastructure, what we're adding to that is pursuant to the direction of Governor Abbott, everything listed in the U.S. Department of Homeland Security in its current guidance for the essential critical infrastructure workforce, we call that CISA, and that basically has been amended to 3.0. And so that does allow some flexibility in certain areas. Then in item 6, in that same section, we have deleted at the end of, and this is under the one that says essential services necessary to maintain essential operations of residences or other essential businesses. We've deleted the very last part of the last sentence, when necessary to assist in compliance with legally mandated activities. And I think that was just, we felt like it was something we needed to work out. Then under item 9 of that same section, we added to, this is real estate transactions. This order does not prohibit showings so long as CDC guidance is strictly followed. And then on item 16, we added, and item 16 talks about this executive order incorporates the attached table, disaster restrictions, as if set forth verbatim herein. In the event of a conflict, the text within this executive order prevails. And we'll go back to that table, and I'll tell you the differences in that in just a minute, or the things that we've added. And then item 19 talks about the effective time, and what this says is, and this again mirrors the governor's order, and it says this executive order shall take effect at 11:59 p.m. on April the 21st, 2020. And obviously that's today, and so it would go into effect at 11:59 tonight. And again, the date on it would be today, this 21st day of April 2020. Now, with regards to the table, the items that we have added to the table, on page 1 of the table, on the right-hand side under restrictions, down where we say worship service, it says, as of April 3rd, the Tarrant County Public Health Officer identified substantial community spread and transmission. And then the new part is, therefore, the CDC states that houses of worship should cancel all in-person gatherings of any size. So it just kind of, again, details that out a little bit more. On the next page, on page 8 of this, what this new order would be, we have added under essential businesses summary, we have added urgent care facilities. We have deleted food service providers, food cultivation, farming, fishing, livestock, delivery, and shipping not open to the public essential critical infrastructure. We deleted that, and then we're adding to an essential business summary, car dealerships, including the sale of all vehicles and car rental. And then on page 9, we are adding
Tell me why we've taken food service provider off.
I'm guessing because of CISA 3.0.
They were eliminated in size of 3.0.
Okay.
Under, that does not affect our ability for them to be able to do the drive up and order.
Okay.
They're still as is they would have been otherwise.
Okay.
On page 9, we have added, as far as details, firearm and ammunition suppliers, shooting ranges, hotels, manufacturing. Under essential critical infrastructure summary, we've added the following words: work necessary to the operations and maintenance of the critical infrastructure sectors as identified by the most current guidance issued by the National Cyber and Infrastructure Agency, which is CISA. And I believe that is it. So with that, I would ask if there are any questions, and if not, I will. Do I want to sign this now and then the court ratify that?
We can do that if you'd like.
I want to thank Chandler for sending us a copy of the revised order.
So, and I do have questions.
Okay.
Okay. So let's go back to page 2 of the order, number 9, where it talks about the healthcare facilities. And so, in looking at the governor's order, I just want to make it clear for folks who perhaps haven't seen the governor's order what it's saying. But, I mean, it kind of lays out what a healthcare facility can do, but they still have to have measures in place to address, like, capacity, reserving a certain percentage of their hospital capacity for treatment of COVID patients and things like that. So it's not just pretty much opening all healthcare facilities back up, but it is just allowing for more procedures, necessary procedures to take place.
And that's a very good point,
Yeah.
because again, as we talked about earlier, the importance is watching those capacity numbers. And you're exactly right. This is not, what the governor is saying is that you must maintain. Was there a particular percentage in there? Was it 30%?
25%. Yeah.
25.
Okay.
25.
And I think it's important to read this point, so I'm going to do it. It'll take, I don't know, maybe 45 seconds. But in his order, it says all licensed healthcare professionals and all licensed healthcare facilities shall postpone all surgeries and procedures that are not medically necessary to diagnose or correct a serious medical condition of, or to preserve the life of a patient who, without timely performance of the surgery or procedure, would be at risk for serious adverse medical consequences or death, as determined by the patient's physician, provided, however, that this prohibition shall not apply to either of the following, and that's where it goes into reserve capacity and things like that. So, okay. So I just wanted to be sure to make that clear. Otherwise, it could seem contradictory that we're concerned about hospital bed capacity and ventilator capacity, but yet we're allowing for more procedures, which we are, but they still would need to be deemed medically necessary. Okay. So I had a question on.
I'm not altogether sure that last deemed medically necessary is true.
Okay.
I think what it says is that if you get to the point to where you have plenty of PPE and you have the capacity, that you can do your surgeries. Now, isn't that the way y'all have interpreted that? So you can open back up to elective surgeries, but you must not be depleting the state's supply of PPE. So you're not requesting any PPE from the state.
Okay.
Nor are you going below the 25% available bed capacity. remember also in there, that bed capacity is, doesn't take into account the relaxation that the governor has allowed for being able to put more than one person in the room. So what we've done there, I believe, is we've still got more capacity even at that 25%, if we had to, if we begin to see a jump in that. But 25% is, you know, that's close to 1,250 rooms that would still be available. And I'll remind you that I think as of today we had 100, or as of yesterday we had 123. So that would only be 10% of the of this reserve, available reserve that we currently have in there. So.
123 hospital beds that were being occupied by a patient with COVID. Right?
Correct.
Okay.
Correct.
Okay, gotcha. So, and I heard your Commissioner Fickens had a question about the food service providers, and I heard the explanation, but I don't understand it. So it was eliminated in CISA, and so, but it's, I guess, where else is it addressed so that we're not limiting food capacity? And maybe it's unrelated, but if so, I don't understand.
We'll
Good morning. The food services that was listed in the table was referenced from the agricultural section of CISA,
Okay.
and that whole section was deleted.
Okay.
The restaurants and pickup is still permitted under paragraph 7.
So then how do restaurants get food if we eliminated food services? I mean, I still don't get it.
There are other sections of CISA that is not under the agricultural component that would allow the transport and distribution of certain things, including food. It's just that reference was taken from the agricultural section, and it had to do with, it was a summary, and so it's larger in CISA, and that part was eliminated. But there are other exceptions in CISA that allow distributions and deliveries to continue to be made to operate these essential businesses.
Okay. And so we're not eliminating, I mean, we're removing this language, in essence, cleaning up our order, but we're obviously not removing anything, I mean, the accessibility of food, basically.
That is correct.
Okay.
That is correct.
Gotcha. Okay.
Any other questions?
Don't go far.
I don't think so.
Your Honor, before we take any action, we do
Yeah, I've
have-
got a couple of audience participants. Okay, so the first one is Geraldine Cox. I'll be calling you in just a moment. Maybe.
Fox, I'll be calling in just a moment.
Hi, Geraldine. You may want to mute your phone because I sure don't want to have to listen to myself talk.
That's a deal. I now mute my phone.
Say again? Okay, you had put in a wish to discuss item 9A1, so if at this point in time you would like to discuss that, please start off by giving us your name, address, and then make what comments you wish to make. And you can unmute your phone now.
Can you hear me?
Yes, ma'am, we can. Thank you.
All right. My address is 6212 Reddenson, Reddenson Drive, Fort Worth, 76132. I appreciate the fact, sir, that you all are always in a posture of having to react to what's going on from the governor's office and from the federal level. but I find that what is happening here this morning is kind of confusing. And so I know that that confusion will be somewhat cured when your new revised order is posted and we can see it. But what I would like to ask for from you and from the health department and from the committees that you have appointed is that you consider following the model Governor Cuomo or some of the other governors or county judges who have taken up the availability of broadcast time from public media to do a kind of detailed explanation not only of what is being done, but also why it's being done. There's a crucial public education function here that could be more thoroughly done, I think, here in Tarrant County. Essentially, I have run into people out now who are, they want out. They want to bust out of stay at home. I see them, and the problem is, without public education that repeatedly stresses that it isn't just hospital beds, the other problem is the more people we have circulating, unless we are very careful with our distancing and unless we wear masks, the more people who are circulating in the community, in businesses and elsewhere, the higher the rate of potential infection and reinfection. And so ultimately, if we cannot persuade people to abide by the distancing that they need to, we cannot ever really get to where we're safe in the community as we once were. Testing truly, I believe, is the linchpin. You have voted this morning to reallocate some money, federal money, for additional testing. What I want to know from your experts is sort of where we are with respect to getting what percentage of the total population tested so that we will have a better feel for what I think is wanted is a random sample that is statistically significant that tells us how many folk really are out there, symptomatic or asymptomatic, who have the coronavirus. Because until we know that, we don't really know the extent to which we can let people go back to work in shoulder-to-shoulder or crowded type occupations, which are essential. I'm going to miss my bacon and my pork chops. If the meatpacking industry craters, I will be tired of soy way before we get more meat. I mean, there are just a whole bunch of problems out there with how to keep the economy going in the face of a potential cratering of our ability to produce critical foodstuffs and other things.
Okay, Geraldine, you're at about the 4-minute mark, so I need to ask you to wrap things up.
All right. Well, my request is more transparency, more public education with respect to what you're doing, and keep on keeping on because you are doing good work, and I appreciate the difficulties under which you work.
All right, Geraldine, thank you very much for your comments.
You're welcome. Have a good day.
You
good
too.
luck with it going forward.
Thank you. You too. Okay, next I'm going to be calling Bruce Miller.
Hello?
Bruce, this is Judge Whitley, and you had called and asked to speak regarding item A1 and A2 of our Commissioners Court agenda. So I would ask that you begin by saying your name and your address, and then we'll recognize you for about 3 minutes.
Thank you very much, Judge. My name is Bruce Miller. My address is 3932 Wayburn Drive, Fort Worth, 76109. I'm a retired physics professor for TCU. I would like to thank the court for the excellent reporting of the data, and I would like to let you know that I've been studying the different models of the pandemic that are coming out of different universities and departments of health, and the models all show that without large-scale strict adherence to the mitigation rules, we will have problems. That adherence is essential. If there are pockets of non-compliance, such as might occur in unincorporated areas, for example, that will cause problems county-wide and more death. We really need to establish strict rules of operation for businesses concerning masks, concerning sanitation, concerning distances, and we need to have regular inspections, perhaps by the sheriff and constables, to enforce those regulations. And I have seen several examples or been informed about them that concern me. For example, a supermarket nearby where the workers are not uniformly masked, or a birthday party that I witnessed on a street where there were 10 or 15 people not obeying distancing. So I want to caution that reopening prematurely will lead to a second wave that will be very difficult to control, and we will experience a lot more death. There was one point in Dr. Tanika's discussion that I would like to disagree with and point out. And the doctor said that as we test more, if the percentage of positive tests decreases, that will be an indication of the waning of the virus and would justify going to another phase of reopening. And I would like to caution against that very much, because as we test more, we're going to find a lot more people that are basically carrying the virus that are not seriously ill, so they would not qualify for the test as they're being offered now. So we would expect then that the number of positives would go down, but it's the total number of infected people that we have to be concerned about, not the percentage number. So I think that would be dangerous to use that as a criteria for opening things up. So thank you for your attention.
Bruce, thank you very much for your call and for your comments. Have a good day.
Okay, thank you.
Okay, next is Laura Lehman. I'll be calling you now.
Hello?
Laura.
Yes.
This is Judge Whitley. You had called in and said you wished to speak on item A1 of today's agenda, and so what I would ask that you do is to repeat your name and your address, and then we will, and then you have 3 minutes in which to make any comments you wish to make.
Okay, starting now.
Yes, ma'am.
My name is Laura Lehman, and my address, do you want my full address or just my city?
City will be fine.
Colleyville, Texas, zip 76034. And my concern is regarding businesses opening too soon. My concern is for the safety of my child who's medically complex, who already is on oxygen 24/7 and is already using a ventilator. My concern is not just for him, but for all citizens in the city of Colleyville with the spread of COVID that is very clearly apparent. The city of Colleyville is allowing certain businesses to open, such as patios that adjoin to restaurants. And I did not see that there was a requirement in this opening of certain businesses, namely restaurants, that people still wear face masks if they're going to be near each other. There's scientific evidence that a pandemic such as this will likely have a second wave, and it could be a lot worse, which would impact us both economically as well as our health. And we already know that people are dying of this. So my main concern is, as the city of Colleyville has decided to do their own thing, I don't understand how that's possible within the county limits. And I also am curious what the county can do when a city does not adhere to those restrictions.
Thank you, Laura. I guess my comment would be, I think I have just recently seen the proclamation. I do believe that this could very well be in violation of the governor's orders.
Right.
Again, Colleyville has their own emergency management plan. They have issued their own declaration, and this is an amendment to that declaration. But I do believe, and it's my understanding, that we cannot be we can't be looser than what the governor's orders are. And I believe that at least in items 2 and 3, the proclamation that was put out today is looser than that. But again, that's pretty much the city, I think, that would be responsible for policing the city. So that's a little bit of the difficulty that we have there. I would strongly suggest that you make your thoughts known to your city council as well as your mayor.
Correct. I do have my letter I've already started something. Of course, I'm a mom that's also trying to teach in the middle of all of this and trying to stay on top of what's actually happening around me. But I will definitely be sending something in to both my mayor and the council. So I appreciate your suggestion.
Well, and I understand how busy you are, because my oldest daughter has 2, and she says, I appreciate the teachers a whole lot more than what I did before this thing started.
No doubt about it.
Laura, thank you very much for your phone call.
I appreciate you calling me back. Thank you.
You bet. Thank you.
Yeah.
Uh-oh. She gone. Okay, the next will be Devin Pipes.
Your Honor, I do not believe that Ms. Pikes had wanted to make a comment, did not want to speak. She did not wish to address the court, but had comments.
Hello?
Whoops. Is this Mr. Pikes?
Yes.
I'm sorry, I called, I think by mistake. I thought that Devin wished to make comments, but I'm told that she did not wish to make any comments, public comments at this time.
No, if you just read the statement, that'll be perfect.
Okay, thank you very much, sir. Have a good day.
Thank you. Bye-bye.
Okay, so this is from Devin Pipes and North Richland Hills. Thank you for allowing the people of Tarrant County to make their own decisions regarding wearing masks in public rather than forcing it upon us with the threat of fines and jail time as Dallas County has done to its citizens. Please do what you can to allow businesses to reopen with precautions and encourage Governor Abbott to do the same ASAP. We have not seen much of a rise in case numbers since last week, certainly not a 4-day doubling rate as was suggested would happen. It is time to start backtracking some of these regulations. Happy San Jacinto Day from the fourth great-grandson of John Files Tom, a San Jacinto veteran. Thank you for that comment, and we will duly note it. Okay, next is some folks who wish to make comments about item number 1, and I'll try to read through these as best I can, and hopefully not miss any of them. Okay, first is Molly Laughlin from Bedford. Executive orders. Commissioners need to stand with opening this week and not wait another month. Unacceptable to keep putting off. Want to start opening this week, as Whitley has discussed. Again, that's from Molly Laughlin, and I would just say that the governor's order is through April the 30th. And what I have indicated in some of my discussions is that we may need to prepare to reopen, but I'm not suggesting that we reopen right now. It is extremely important that everybody understand that we must maintain the course that we're on right now, and hopefully if we do that, then by hopefully the first or second week of May, we can begin to lessen those restrictions. But in order to be ready to do that, we need to begin planning now as to, one, what the new norm will be. When do we wear masks, social distancing, how many folks do we allow in establishments, those types of things. But we must maintain the course that we're on right now if we're going to get to the point to where we can do that. And the one thing that I always want to put as the asterisk is that for anybody that is 65 and older, for anybody that has any underlying health issue, it is critically important that you be very, very careful about going out, and that when you're around folks, that the folks that you're around should be wearing masks to protect you from them, not them from you. So the next comment was from a Bob Bofinger, concerned with Colleyville City Council allowing businesses to reopen. Seems to fly in the face of logic, data, medical evidence, and reason. Please do whatever you can to stop this. We talked about that just a few minutes ago. I'm not sure that there's anything we can do to stop it. Dorothy Valdez, Lake Worth, great concern about reopening too quickly. We still have not reached a peak in Tarrant County. To open non-essential businesses would be a detriment to our Tarrant County communities. Next is Deborah Thompson, Lake Worth. Too soon to reopen non-essential businesses. Understand we are under economic stress, but if we can't just hold a little longer and get numbers down more, it would be better. Okay, Devin Pipes, I think we just
we did that one.
Yeah, we did that one. Deborah Moore, that name, okay. again, from the Fair Creek Terrace area of Fort Worth. Take logical steps to reopen. Wait until we have declining numbers in the numbers of cases and deaths, especially restaurants, hair salons, waiting 2 to 3 more weeks of declining numbers. Again, what we're proposing will be something that would not open those things up for at least 2, maybe 3 weeks. So we're right in line with what y'all are talking about. Again, we are discussing the new norm and then how to train people, and that will take a 2 to 3 week period. So please don't think, don't think you can relax now. We must stay the course, stay at home, stay inside, don't get together in gatherings, stay the course. Jacqueline McCrary, Fort Worth, would like to see more testing before consideration of lifting restrictions. We hope that we're going to be opening at least 2 test sites this week. We'll talk about that a little bit more, but we're seeing more and more reagents appear now, and the problem that we've had with testing in the past has been the inability to get the reagents necessary to actually conduct the test. Karen Grisham, Fort Worth, would like to see more random and availability of testing to have more research before considering reopening. We just talked about that a little bit. Barbary, Ergami, well, we'll leave it at Ergami. Texas should not even think about lifting restaurants until June the 1st per the University of Washington study.
Restrictions, not restaurants.
Okay. Texas, you're right. You're exactly right. I just saw that REST and went right into restaurants. Texas should not even think about lifting restrictions until June the 1st per the University of Washington study. I believe that is all of the comments that I have with regards to A1. Okay, that's just the order to sign. So I'm going to sign the order at this time, and then at that point in time, y'all can ratify the order, I hope. So the order was signed at 11:30 on the 21st of April, 2020. Do I have a motion or a second to ratify the order?
So moved.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously. Now, Mr. Manius, I think that takes us to item 2. Moving right along.
Yes, sir. Okay, so we have several items as relates to item number 2, but before we get into those particular items, last week we talked about the county jail and the infections within the county jail, and we've asked the sheriff if he would address the Commissioner's Court at this time to give you all an update on that.
Good morning, Sheriff.
Good morning. How are y'all doing? I am, first of all, happy to report for us out in the unincorporated area. Our deputies are doing a great job of education and encouragement. We haven't seen any flagrant violations, and the things that we have saw, where we saw some things, they were able to encourage, and there's been no enforcement action taken or anything like that. I would like to say they did run across a couple of moonshiners, and when they approached the still, they realized, like everybody else, they were just making hand sanitizer. So that's what we are.
More money than that.
Yeah, we currently we have 8 confirmed inmates with COVID virus. 2 of them are in transitional to recovery. 2 are at JPS, but expected to do well there. And then we have 4 that have mild symptoms at the jail that are certainly quarantined and isolated. And the majority of these inmates did come out of Green Bay. And I want you to know that the troops and the team out there is doing an incredible job. They're jumping in and initiating things to make sure they take care of the people that are there and take care of each other. So while social distance is very difficult in law enforcement, they're doing the best they can with what they have, and they're doing a great job. But the entire jail is doing a very good job of making sure that these hot spots stay isolated, and we have transitional quarantines, and we have quarantines when they come in the jail, and we're still doing that. If somebody shows up and they're running a temperature, we turn them away where they have to go to the hospital and get cleared, and those kind of things. We also we have just notified our 3rd jailer has COVID virus. Our 1st jailer is well on his way to recovery. The 2nd jailer and the 3rd jailer are brand new, and we're monitoring them. We had 3 deputies with the COVID virus. 2 of them have completely recovered and are back at work. The 3rd deputy, talked to him today. He's doing great. He's going to have his 2nd negative test within the next 24 hours. We expect him back at the end of the week. And also working with the DA and the judicial and the district attorney's office did a great job. They've combed the jail and looked at misdemeanors. And those that are not a threat to the community or not violent offenders, we have been able to release, I believe, a total of 10 of them back out. Our current jail population is at 3,300 this morning. We do have 261 inmates ready to go to the state penitentiary, but only 4 of them are over the 45-day limit. And in visiting with them, they hope to reopen here in the next week and a half. And that's the status of the jail this morning. Again, people are working very, very hard down there to mitigate at every corner and to isolate. And the outpour of the community has still been incredible for PPE. We've got some of that. We need more. But also we have people stepping up because we closed the ODR, our officers' dining area, and we have Old South Pancake is feeding the jailers on Thursday. Just an incredible outpour of the community.
If you're accepting visitors, I might come down.
Well, we'll make an exception, Judge.
Thank you, Sheriff, for that update. Would you repeat, you said that there were 261 inmates that were ready to go to the state, and how many were over the 45-day period?
4.
4, okay.
As of this morning.
Thank you, Sheriff. Oh, I'm sorry.
And I know that you all have long since changed like the visitation to the inmates, but obviously there are others that have to visit the jail in order to keep business going. So do we know about if any of those folks have reported positive COVID cases?
Are you talking about visitors to the jail or contractors?
Contractors.
Yes, ma'am. They have, and there's a total of 12 contractors that have reported the virus. We do not know the severity of those 12. We understand that one has been critical is the only thing that we have, and part of those are the food service and the commissary service. And but I got to say that right now the operators have stepped up and done everything that they can to make sure that we're providing safe food to our prisoners, and everything else that has gone on around that. Like I said, the officers are stepping up. Trustee inmates are stepping up. It's a real team effort going on down there.
Thank you.
Judge,
Yes, Roy.
I want to thank the sheriff for continuing to work with the criminal district attorney's office and the courts to lower the number of misdemeanors in the jail. I think you have heard me, and I thank you.
You're welcome, sir.
Thank you, Sheriff. Appreciate it. Appreciate
you
the
all.
hard work of everybody down there.
Yes, sir.
Appreciate it. I do have a couple of comments with regards to this item on the agenda also. Did you have anything else?
No, we have two action items under this particular item, but if you're going to take the comments first, that would be good.
Yes, please. Max Kronkmal.
Hello.
Max, this is Judge Whitley, and you had
Yes.
indicated you wish to address the court on item A2 of our agenda. So I'm calling.
Yes,
If you would, please say your name and give your address, and then you have about 3 minutes to make comments.
Sure. Well, thank you for calling. My name is Max Krockmal. I live in Fort Worth, Texas, 76104. I'm calling to urge the County Commissioner's Court and the Sheriff's Office to do everything possible to reduce the jail population in these times. The prisoners, people who are incarcerated or detained, are at huge risks of contracting COVID-19 and of getting sick and dying, as well as the jailers and other staff that work there. And other jurisdictions have taken the lead on this. So I agree with what Commissioner Brooks has said. I applaud what's been done so far, but it's nowhere near enough. We need people who can be cited and released to be cited and released and not booked into the jail at all. We need the county to end its practice of collaborating with ICE, Immigration and Customs Enforcement, and with CBP, Customs and Border Protection, and not have people in this hour who are passing through Tarrant County or living in Tarrant County ending up in the county jail simply for immigration issues or for nonviolent offenses or nonviolent crimes. People are being booked and held in jail where they're being exposed to the virus for things like small amounts of marijuana, which in other states is an essential service. And here we're risking people's lives in order to incarcerate them. So I would urge the court to revisit the 287G agreement once again, and it's been 9 months or 10 months since you last approved it. It's time to see if it's working, and especially to overturn it in the context of this dangerous virus. And I urge the Sheriff's Office to stop arresting and booking people who don't need to be in the jail. The state has already stopped admitting new people to its prison, and the county, Tarrant County, needs to do the same. So that's all I have to say. Thank you.
Max, thank you very much for your comments. Have a good day.
You too.
Next is Lizzie Maldonado. Be giving you a call now, Lizzie.
Hello?
Good morning, Lizzie. This is Judge Whitley, and you had indicated willingness or wishing to speak to item A2 on our Commissioner's Court agenda this morning. So I would ask that you repeat your name and your address, and then you have about 3 minutes to make whatever comments you wish to make.
Sure. My name is Elizabeth Maldonado. I live in Fort Worth on 3016 Tex Boulevard, Fort Worth, Texas. And I'm calling because I'm concerned about the spread of COVID-19 in the Texas prison system. I'm concerned that we're adding more individuals to the prison population each day while the virus continues to spread among people who cannot practice social distancing, who cannot access like sanitary and hygiene supplies to protect themselves. And I'm concerned that the well-being and health of those people isn't really being considered in this time. So as of right now, I'd like for the county to follow the leadership of counties across the country who are refusing to add to their prison population, especially for low-level nonviolent offenses like drug-related crimes, or property crimes, things like that, or to refuse to hold anyone who hasn't yet been convicted of a crime on cash bail, as well as any medically at-risk individuals. That's my whole comment.
Okay, Lizzie, thank you very much for your comments, and you have a great day.
Thank you.
Goodbye. Bye. Okay, last comment on this particular item is Pamela Young, and I'll be calling you at this time now, Pamela.
Hello.
Pamela, this is Judge Whitley, and you had expressed a wish to speak to item 8.2 on our agenda, and so I'm calling you at this time. If you will repeat your name and your address, and then you have 3 minutes to make any comments you wish to make.
Sure, thank you. My name is Pamela Young. I live in Fort Worth, Texas, in 76111 zip code. I'm calling on the Commissioner's Court to hold Sheriff Bill Wayburn and the Tarrant County Sheriff's Department accountable and responsible for proactively finding ways to reduce the jail population beyond what it has already been reduced. The 10 people that he announced today being released is nothing compared to what needs to be done. As you know, state prisons are no longer taking incarcerated people from county jails. That means those persons remain here, and our jail population stagnates and balloons, which further exacerbates the impossibility of social distancing in the jail if nothing is done to release those who can be released. Until today, each time I hear Sheriff Bill Wayburn questioned about his role in reducing the jail population, he shuffles responsibility instead of taking the initiative to identify those in his custody who might be good candidates for release to the criminal court judges. In particular, those who are pretrial and accused of nonviolent offenses, those serving time for nonviolent offenses, and most importantly, those who are medically at high risk due to factors like age, underlying health conditions, or pregnancy, all of which are screened, tracked, and reported at bookend for each incarcerated person. Sheriff Bill Wayburn and his medical personnel can generate this prioritized list, as the sheriff in Dallas County has already done, and present it to the criminal court judges and to the DA where necessary to expedite reducing the jail population and protecting more people, including staff and incarcerated persons and community members, from unnecessary exposure to COVID-19. The number of positive cases, as you heard today, in the Tarrant County Jail will only continue to increase, not decrease, especially with food service workers having been infected. And I'm getting a report, as a matter of fact, right now from someone at Green Bay saying that they have 24-man cell pods under quarantine, and new people are being admitted into those pods of 24 people. That is against regulation. If you're under quarantine, you shouldn't be admitting new people to those pods. Commissioners and Judge Whitley, will you ask Sheriff Bill Wayburn to generate this list, this prioritized list of folks who are eligible and folks who are medically fragile, for presentation to the criminal court judges in order to expedite release of eligible persons? That is my question.
Okay, thank you for your comment. I would just make the comment that, as I think the sheriff has said in the past, he is, basically they come into his jail. He is making the folks aware. We've got the magistrates. Those folks are aware of the folks who are in the jail. And once that they're made aware of it, it becomes the responsibility of the DA working with the judges to determine, and the magistrates as far as the bail and stuff goes, to determine when or if those people can be released. The sheriff takes that direction from them, and he does what he is instructed to do via that, those other sources. And so I hear what you're saying. I know that before we entered into this deal that our population at the jail was over 4,000. So we have reduced that by over 20% and or close to 20%. And so I feel like that the sheriff is certainly working in that respect from that perspective. So I don't know if anybody else would like to make any comments, but thank you very much for your comment, Pamela, and you can go ahead and continue to listening as we go forward. Thank you.
Thank you.
So I would like to know if such a list exists, and obviously I know that these various departments have been working together, and then also to see if the sheriff has any response.
I'm sorry, Commissioner.
I said I would like to know if such a list exists, the list that Pamela had mentioned. She had multiple points to that list. I don't know if I wrote it all down. And then if you just generally have any response to the comments that she had.
I don't know. I couldn't hear her back in the back on what list she was talking about. I did hear a couple of things. I will tell you, our medically fragile people have been placed in solitary, where we have a huge medical team over there. They're being taken care of there. The DA's office and the judicial people are working every day to look at who's in there, what they're doing, and who needs to be out. And when I say they've combed the jail, they have combed the jail looking at different things.
We're having some feedback. I don't know, Commissioner Johnson or Commissioner Brooks, you might want to mute your phones because we're getting some feedback from one or the other of you.
But our staff, our command staff, and our others are always looking at who's in jail, what they're doing here, and what can be done. The people that generally remain in jail have lengthy criminal histories. They're violent people. They're a danger to the community, and the folks that called in, the good people that called in, just might disagree with us that some of those people don't need to be back out in the community. And as far as mitigation of the virus itself, we have isolated people, and the quarantines that are going on with the different cells is the new people coming in today are not going to those pods. They're going to this is the 21st. We call them the class of the 21st. And the people they come in with, there's about 18 prisoners that they will be with. All of those people are pre-screened, not once, but twice before they ever enter the jail and go into housing, so that we look at them and we check them twice a day during the first 14 days they're here. And the model that we put together has been the model that the state commission is using around the state. And I've been on national programs because other jails across the country are using what we're doing here in Tarrant County.
One of the questions that she may have had, I heard her say something about being in excess of 24. And I don't know if she was saying that maybe one of the pods, she mentioned Green Bay, and mentioned that one of the pods might be in excess of 24. But again, I don't know whether that's the case or not.
I don't have the numbers in front of me, and I wouldn't want to say, but we have pods that for instance, a COVID virus came out of a pod, we isolate that entire pod and the pod next to it, because at Green Bay it's bars, it's just bars separating people, so they can harm each other, and we've isolated pods like that to keep those people together. And then when we say we isolated them, doesn't mean anybody in there is sick, doesn't mean anybody in there is even symptomatic. But what we do is, just out of an abundance of caution, we clean those areas and try to make sure that it's as clean as possible, that it's as safe as possible for both the inmates. At Green Bay in particular, everybody's in mask. All of our officers and them, everybody in our jail downtown is in mask, except now TCC and the LEC, they're not in mask because we don't have that much PPE, but we are doing that at Green Bay.
Thank you, Sheriff.
Thank you.
With that, I'm going to...
Judge.
Yes, Commissioner.
I think that what Pamela was asking was that the sheriff be proactive in scrubbing the list of jail detainees and making a list of those who are there pre-trial for misdemeanor and nonviolent offenses, and being proactive about submitting that list to the DA's office and the courts so that they can be considered for release. I don't think that does any violence to the judicial or criminal justice process, and it's probably something we ought to do.
Commissioner Brooks, if I may add, and the DA vigorously, and our staff, we looked at every misdemeanor in court last week. We'll look at them every one of them in the jail this week again. We're doing that weekly.
Thank you, Sheriff. With that,
Thank you, Sheriff.
With that, we're going to take about a 15-minute recess, and then we'll get into the rest of that. Oh, wait a minute, where y'all going? Okay.
Oh, did you gavel?
Yeah, I already gabbled. Hey, I got two on the phone. I got you guys beat now.
Is it time?
It's getting close.
Did you do your deal? With
Yep, I did that. All right, Mr. Manius, let's go.
Okay, members of the court, we can now go to, or continue on to item 2 under the administrator section. We have 2 action items that we're seeking, and we provided this communication to you, I believe, either yesterday or this morning. It should be in your red folder also. These 2 items are obviously related to COVID ID. The first is that, let me explain this just a minute. Public Health and MedStar have teamed together to provide educational services, and they provide those educational services and specialized training to extended care facilities, senior independent living centers, assisted living facilities, and skilled nursing facilities in Tarrant County. They provide them with an educational toolkit on precautionary measures to prevent the spread of COVID. So what this MOU does, it simply ratifies and it memorializes the responsibilities and the team effort of both Public Health and MedStar as they do this training. And so we're requesting that the Commissioners Court approve that memorandum of understanding.
Move for approval.
Second.
We have a motion and a second. Any discussion?
I'd just like to say that I'm glad that we're doing this. I know that it's been obviously a lot of conversation about what's happening nationally in some of these facilities, and obviously we've been engaged with the ones in Tarrant County, but if there are things that come up pretty often as I'm talking with constituents in Precinct 2, it's what are we doing, which I know that we have been doing things, but I think this is great from a prevention standpoint.
And just to comment, we need to really thank Dr. Tanasia. He's been working very hard on this particular agreement.
Okay, with that, we'll now vote. Commissioner Brooks? This concerns me.
We lost the phone, unfortunately. I apologize. I'm trying to get it back up.
Were both of them?
Yes, sir.
I have a question. It's related to this item, but it's not going to change my motion on it. I know that CMS, I guess, recently came out with some additional oversight measures for these facilities. I don't have a sense of what all those are, but like maybe in a future court meeting, Vinny or whoever the appropriate person could.
Sure, and we'll get that information and we'll put it in a memorandum and send it to the entire court.
Thank you.
To enable audio controls, please enter.
I'd say go ahead and vote. There's 2 of them. Might not like that. We're now ready to vote. Commissioner Brooks?
He probably wants to know what we're voting on.
He could have been watching the video. He could have been watching the video.
Commissioner Brooks, if you're there, we're requesting that the Commissioners Court approve an MOU between Tarrant County and MedStar for educational purposes.
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously.
Members of the Court, we could go to...
Judge, before we go forward, could I make a comment, one more comment about the overcrowding situation in the jail? One of my staff members was contacted by the Director of Juvenile Services asking that we not ignore the overcrowding at juvenile, and saying that they are overcrowded and a large portion of that population could be released, and that we include them in our taking a look at that situation and consider their population for release as well.
Okay, we'll pass that comment along to our district attorney, as well as the juvenile area. Thank you.
Thank you very much.
So, members of the Court, the second action item on this particular issue is a collaboration agreement with the Alliance for Innovation. And so let me explain this a little bit. You might have heard Judge Woodley talk a little bit earlier about opening test sites. And part of the online application is run through a service agreement between the Alliance for Innovation and Adobe. And we've been working with Adobe to ensure that individuals could go to our site whenever we set it up, and that they could register online. It has a particular algorithm which determines if those individuals qualify to be tested. And in order to utilize that system, and IT has been involved with it, public health has been involved with it, UNT has been involved with it, UT Southwestern has been involved with all this, and we now have an agreement with Alliance for Innovation in order to use that software. Alliance for Innovation is a nonprofit, and this is software that we'll be able to use until September 30th, or until at least September 30th of this year, at no cost to the county. So we're requesting that the court approve the collaboration agreement with the Alliance for Innovation.
Move for approval.
Move approval.
Second.
We have a motion and a second. Any discussion?
Yes. And I get obviously that this agreement is necessary for us to continue with our increasing testing capacity. I have a concern though about those who don't have access to the internet, and maybe it's more so a question of for whatever respective sites, like how the screening will take place. But if this is our primary way, then how will we care for those who don't have access?
So let me attempt to address that.
Okay.
So besides the fact that a person can go online to fill this out, we're also going to have a telephone number that they can call. And once they call, there will be people that will answer that call. They will fill out the application for them, and they'll make a determination if they qualify. If they qualify, they will give them the location and an appointment time for them to come through the testing site.
Okay, great. Well, and I'm glad to hear you say that if someone calls via phone, that we're still using this system. That way all the data is still in one place and it's uniform, so that we can...
That's correct.
Okay,
and that's important because we're trying to get clean data on all of this so we can do our analyzation of that data.
Okay, very good. Thank you.
Any other questions? Okay, Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously.
So I have one additional item as it relates to item 2. As most of you have heard, the federal government has passed several acts concerning the assistance to the nation and local governments as it relates to Corona. And it's called the CARES Act. Right now, I think that we sent you an information sheet yesterday that details, what the CARE Act is and how it would affect Tarrant County, and especially that part which deals with state, local, tribal, and territorial governments. And I'm not going to go over that entire list because we've sent that to you. I think it's good background information. This list was originally requested by Commissioner Brooks. It tells you what we can use the money for. Tells us what we cannot use the money for. Just some numbers. The city of Fort Worth is going to get about $156 million on this. Tarrant County is going to get about $207 million on this particular act. We hope to get that money into our accounts, and Ms. Tidwell and the auditor's office has set up a special account to receive it. Hopefully we will get that by the end of this month. We talked a little bit about this last week and the need for the Commissioners Court to do some planning on how we're going to expend this money. I know that we are meeting with some of our city partners, not just Fort Worth, but Arlington and the mayors and city managers, and we're trying to determine if there is an additional avenue for monies to come to those municipalities through the governor's office, and we believe that that's a real possibility. The monies that were handed out directly to the local governments were for cities and counties that had a population of 500,000 or more. So we are doing some evaluations on this. One of several concerns that we have on this particular amount of money is that, first of all, it can be spent on only COVID-related activities, and that has it can be some reimbursement to the county. Monies can be given to nonprofits. It involves testing and issues like that. This is a major thing for us as far as how we manage and develop strategies for the Commissioners Court to consider. And one of the areas that we're looking at, Harris County, when they had Hurricane Harvey, they received a substantial amount of money, and they actually hired a private firm to do a lot of the internal activities and working with the governmental bodies to determine how the money can be spent, make sure that it qualifies. We're looking at the possibility of making a recommendation to the court that we look at that type of service. That will not solve all of our issues. And one of the things that this money will pay for are temporary employees that can help us because of the workload increase and the new demands that have been placed upon the county because of COVID-19, excuse me. I've already asked Dr. Tanasia at the Public Health Department to start looking at what type of additional resources he might need to go ahead and bring on board. Obviously, we'll bring all this back to you. We think that maybe administratively, besides contracting, we would be looking at somewhere around 10 to 12 part-time, not part-time, but project people that we might want to consider placing inside the county to do a bunch of this work. A lot of this money can also be used not only for social service related activities like food services. It could be used for rental assistance. I know that Commissioner Brooks was very interested in the rental assistance piece, and Ms. Ward is handling or running point on that for us. But it can also be used for testing and for small business relief. And these are just some of many items. As we go forward, we need to make sure that we begin the process very soon of making a determination of what we might want to spend this money for, because we have to have agreements put in place. I would ask that as you go through that that you allocate a substantial amount, maybe $10 to $20 million for testing. I think testing is going to be important. We've all heard that testing is important. Judge Whitley has been working on testing sites and working with UNT and UT Southwestern, and we can use that type of money to help offset some of the costs on that. So I wanted to bring that to your attention because it's not something that can simply fall to the back burner. It's going to have to be something that's up front that we're going to have to deal with, and we're going to have to deal with it much sooner than later. So I'll just redirect you to the document that I sent, or our office sent you all yesterday. I've already given a copy of that to the clerks for your information, and to the district attorney's office and the auditor's office, and hopefully in the very near future, maybe next week, we can begin talking about how we might want to utilize this money. I will tell you one thing and Judge Willie and I have talked about this, that I have a concern about is that what needs to be addressed yet, and I know that there's efforts being made to get clarity on this, but it's those cities, especially those cities in our county, that didn't get a direct allocations. And there's only one city that did, and that's Fort Worth. And we have a large number of other cities, and that's why we're still trying to make a determination, get direction from the state, really, on how those cities are supposed to go to the state for money. Because the more money that we can bring in, the more money we can spend for the right things is going to bring this county up and out of this much quicker. So I don't know if any of you have any comments. I just simply wanted to lay that in front of you today and know that I want to put it on your radar because we're going to be dealing with this.
I have a question.
I do have a comment.
Go, sir. Go ahead, Commissioner Brooks. Sorry.
Thank you, Commissioner Allen. GK, thank you for sending us this document. It is very useful in explaining what this money is about and how it can and cannot be used. I appreciate having this document before we get into specific discussions about how to use this money, because I want all of us to have the opportunity to give some input on specific uses of the money. You're right, I am interested in tenant assistance, but I am also interested in increased testing, and I am interested to aid to small and minority business enterprises, especially those that might not meet the threshold for federal assistance. So I will be coming forward with some programs for our consideration in those areas, and I thank you.
You know, I think as we look at this, and let me just give you, and we're working in my office along with GK, and wait a minute, I'm sorry, you had a question.
Go ahead.
Well, and when you look at the $11.2 billion that came to Texas, they've said that any county or city over 500,000 was going to get a direct allocation of this 11.2, and that ended up being 6 cities and 12 counties, and the total allocation was about 45% of the total 11.2, or right just a little bit over $5 billion. If you then turned around and took those 12 counties and looked at what percentage of the population of the state of Texas they represented around 63-64% of the total population. And if you allocated it based upon population, that means that those 12 counties would have received $7.1 billion, or approximately $2.1 billion more than what we received when you looked at 45% versus the 63%. And so I think that one of the things that we're going to try to discuss a little bit with the governor is allowing some of that, if not all of that $2.1 billion, to come back to the 12 counties but to be allocated among, as GK mentioned, we have a number of cities below the 500,000 that got nothing or will get nothing. But we might also be able to set aside money for, as Commissioner Brooks just mentioned, some of the small businesses. I know you've mentioned before the women-owned businesses, some of those types of deal, as well as some of our service, nonprofits, as well as some of the testing and things along that line. So I think we've got sectors or areas that we need to begin thinking about. And Commissioner Brooks, what you're suggesting, I think, is a great idea. I think we should all be looking at if we can get, with the money that we have, and with the money I hope that we will continue to get from the governor for that. I mean, Tarrant County's, we collectively right now are getting about somewhere around $570 million. If you'd gone purely on population, we would have gotten $815 million. So almost to almost $250 million more. And so those are the kind of things that I think we're going to have to look at. But as GK mentioned, and I think so, if the governor doesn't send any more of that money up to the 12 counties, then we're certainly going to be there to have to help some of the cities as well as some of the nonprofits and some of the other things we've talked about.
I was just going to add a comment, and I do have questions too, but a comment about how important it is obviously for cities like Arlington. It's the second largest city in our county, and yes. I know that they were, shy population-wise of meeting that 500,000 threshold, but then also for our smaller cities, and in talking yes. with Precinct 2 mayors, I know that's a big concern is how they don't want to get missed, and it's an appropriate concern I know they were all aware of, but certainly that we have to address. My question is, I know that in the document, and it referenced approximately $202 million we anticipate receiving, but then I thought you referenced, and I may have just misheard it, $207 million, and I get it's still an approximate number, but is it between 202 and 207, or which
so I'll tell you how we got there, okay?
Okay.
So when we first began to get the numbers, and these are approximates, we had a range of between 202 and 210. Okay? So when I gave the number to you, I'd rather you all be surprised that you got a little bit more
sure.
than disappointed with the messenger who said you were going to get more and you got less.
Smart. Okay. So second question is anticipated date of receiving those funds, and will they come in that lump sum, whatever that ends up being, or will it be?
We believe it. We know it's going to be a lump sum.
Okay.
And for example, the city of San Antonio has already received theirs. They received $270 million. Mm-hmm. The city of Austin has received theirs. There's $170 million that they've received, and it was a lump sum.
Okay.
So we expect this to be lump sum also. That's important because talking with the auditor, there's getting that large amount of money in, we've got to collateralize it. So.
Yeah. And then when do we anticipate receiving it?
We thought we might get it at the end of this week, but I'm thinking maybe the end of the month. The 24th?
The end of this week.
Okay.
I hope.
Yes, we all hope.
I mean, if San Antonio's got it, why hadn't we got ours?
I was going to work on that this afternoon.
They have now.
Of course, they got their FEMA sites first, too.
Yep.
And so then going to the overview document, I had a question on page 2 related to COVID-19 related facility enhancements. And I know that obviously this is just it's kind of a draft, and we're going to work some of these things out, but what would an example of a COVID related facility enhancement be? Would this be the plexiglass guards, things like that?
That's one of them.
Okay.
You know, we've looked at if we have to house people to manage these funds, then if we have to do some renovations in our buildings, that would probably be something that would be covered in a cost like this.
Okay.
Of course, think about it also in the public health building and expanding labs and things such as that to qualify or to increase our testing capability and to buy equipment then to fill those expanded spaces.
Okay. And then further down in that same area, it says expenditures related to catching up and minimizing COVID-19 backlog in county government. And what's an example of a backlog? In my head, I'm thinking, obviously, business changes perhaps that we've had to make in response to COVID, and things could get backed up related to that.
Right.
Okay. Is that right?
Yes.
Okay.
Or court backlog, anything like that.
The sensitive piece of all this, the thing that we have to make sure that we're careful about, is that while they're going to give us a lump sum of money, and the guidelines are very broad, what will happen and this money has to be used by December 30th of this year. Any monies that were not used for the appropriate activities will have to be reimbursed to the federal government. So we want to make sure that the activities that we're involved in and that we expend the money for qualify under this. That's one reason why we're looking at one particular outside firm that has a significant track record in doing things like this. So, and our listing that we provided you is by no means exhaustive.
Sure.
And so, as long as it's related to COVID, then we feel that those expenditures will be appropriate. Now, the one thing that we're also seeing, in as you follow what's happening in the Congress, is that there is, I guess it's CARES Act 3.5 that hopefully will be out this week. It provides monies to hospitals. It provides monies, additional funds for the PPP. It also provides money for the SBA, things like that. We're understanding that there very well may be a CARES Act 4.0, which would be monies that would be provided to state and local governments that have been impacted by revenue shortfalls and just other things, and those will hopefully be a direct deposit or direct assignment to each government, at least the big governments like us. So we believe that there's going to be more money coming. But what this does, this provides funding to have a real impact on the needs that we have right now. And it's not just internal needs, but think about Meals on Wheels, think about all the transportation related issues. We're having discussions as it relates to elections and all of those things that we're addressing right now, that we can make sure that we have adequate funding to have the greatest impact that we think we can achieve.
Great. That's all I have. Thank you.
Any other questions? If not,
Do we have a motion in a second?
we don't need a motion on this. This is just
Good.
I can only imagine what Commissioner Johnson is thinking right now.
I don't think we can say that out loud.
So, members of the court, if we can go to item number 3. These are leave and pay options, and
Oh,
Ms.
boy.
Glenn is going to
I
be.
can hardly wait to get to this part of the agenda.
This is going to be a very short presentation.
Yeah, I've heard that before.
Good morning.
Good morning. It's afternoon, by the way.
Afternoon, you're right. It's almost 1 o'clock. Time flies when you're having
And we
fun.
had no lunch.
I think we have snacks.
I know we just had some peanut butter crackers up here.
If anybody would like to chop that up into 3 spaces, lunch is being served.
We'll pass. Thanks, GK.
I wasn't talking to you.
So, as Mr. Maney has indicated, we do have an item for the court's discussion and some direction, actually, is what we're seeking today. You all may recall that last week the court voted to extend hazard pay through this Friday. Part of that decision was to reduce actually hazard pay from $6 an hour to $3 an hour. So the $3 an hour went into effect. That rate went into effect on Saturday, this past Saturday, the 18th. Your vote was to keep the $3 an hour rate in place through Friday of this week, the 24th. And so we're looking for some direction today in terms of hazard pay, and you have two options. So the first would be to extend hazard pay. That would be effective Saturday, the 25th. If you wish to extend it, then the secondary question is at what rate? So that would be your option one. And option two would be to discontinue hazard pay effective Saturday, the 25th. And I'll take questions if you have any.
What's y'all's pleasure?
If there's no action by the court, then what would result is that hazard pay would expire at 12 midnight on Friday.
The court has already taken that action.
Okay, no action at this time.
Thank you.
And then finally, members of the court, on item number 4, we're requesting that the Commissioners Court authorize submission of a grant application in the amount of $735,491 to TxDOT as it relates to the 2020 County Transportation Infrastructure Fund grant program.
I move for approval.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge votes yes. Motion passes unanimously.
Thank you, Your Honor.
Ms. Tidwell?
We're asking the court to consider today to release approximately the $5 million as outlined in your court communique of collateral. I'm sure I'll be back
I was
with.
going to say you might want to hold on to that because
Well,
I got a feeling it's going to be.
we'd already set this up, but as soon as the money is received, then obviously, yes, the bank will be looking at collateralizing that.
You just get notification from the bank that all of a sudden over $200 million arrived.
We're checking it daily, and we've asked the bank to notify us, but we're also checking it. And
Vote for approval, release depository collateral.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously. Ms. Glenn?
Move to receive and file.
Move to receive and file personnel agenda.
I second.
We have a motion to receive and file the personnel agenda. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously. Item 2.
Yes, sir. Items actually 2 and 3 are waivers for terminal benefits. The first is from the Fire Marshal. Mr. Nwa is requesting a waiver of 216 vacation hours. We actually started at 400, so this has been whittled down quite a bit. Effective May 4th, we're looking at a net cost to the general fund of a little bit more than $3,110. That does include fringe benefits.
Move approval.
Move approval.
We have a motion.
Second.
Yeah, we have them. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously.
Our final item, as I stated, is another waiver, this time from Probate Court 2. Judge Allen is losing her court coordinator at the end of the month. This individual currently has 300, or will have 389 vacation hours. Judge Allen is requesting a waiver of 301 of those 389 hours effective May 16th. Judge Allen did want us to relay to the court that she believes any delays past that date will impact her court operations. If approved, we're looking at a net cost to the general fund of a little bit more than $11,000, or right at $11,000.
Move approval.
Second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickett?
Yes.
Commissioner Johnson? Commissioner?
Yes.
And the judge votes yes. Motion
Thank you.
passes unanimously. Chris?
Good morning, Your Honor, Commissioners. So we have one item this morning for your consideration. It is requested that the Commissioners Court approve a .gov domain registration through the General Services Administration for the Tarrant County TX.gov domain and verifies the content conforms with the .gov policy.
Move for approval.
Second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickett?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously. Mr. Beecham? Thank you, Chris.
We have 3 items for your consideration this morning. The items 1, 2, and 7. Item number 1 is a bid award recommendation for RFP 2020-035, RFP for consulting services for implementation and validation of public safety assessment for the Criminal Courts Administration. Recommendation be to award per the terms of the contract, awarding to the primary and secondary vendors who shown in the court communique.
Move approval.
Second.
We have a motion and a second. Commissioner Brooks?
I've got discussion.
Ooh, hold on, Commissioner Brooks.
So we held this item, my note that I wrote to myself from last Tuesday was related to COVID timing. So what has changed that now we're ready to move on this?
The timing, the question was the timing issue?
Yeah.
Okay, so our concern was that these individuals might have to, or this company might have to be on site before they can start. And going back with them and working with them, they believe that they're going to, first of all, they said they'd be flexible on their time, but they can start working on this project now without having to come directly on site.
Okay, very good. And then my question about item 7, which was pulled off the consent, is related to this. I know with this item 1 is this public safety assessment. For item 7, it's this risk and need assessment.
So may I address that?
Please, because I'm confused.
Hold on just 1 second. One of y'all needs to put your phone on mute, or both of you. Thank you.
And Commissioner, when you mentioned number 7 earlier, you just caught me off guard a little bit on that. I had to remember what North Point was.
Sure.
What we're talking about here is the risk assessment tool that the magistrates and criminal court administration use in order to determine who becomes eligible for pretrial release out of jail. Okay, that's what this is. This has been a project that we have been working on for 2 or 3 years now, and it all started when we began to not only back up our jail because we were taking more inmates from cities, but also some of the new statutory requirements. So we had all agreed, working with the criminal district judges, that we were going to do this, and we put out an RFP, and so this is going to allow us to incorporate that risk assessment electronically into our systems. And on item number 7, which is the North Point, you might recall last week the Commissioners Court gave approval to begin the implementation of the jail. North Point is a classification system that is going to be, it's an electronic system and it's a paper system. and it allows inmates, when they get to the back of the jail, for the sheriff's department to make an assessment as to how they and where they should be housed, as far as violent, non-violent, things such as that. We've always used this, but it's been in a paper form. And it's the one that there's only one of two different models that the state jail commission allows. This is one. When we begin to move this into an electronic form, there's a requirement that we pay North Point a license fee for the use of that in electronic form. That's what we're trying to accomplish on item number 7. They really don't have anything to do with one or the other. 7 is a classification system within the jail. The first one that Jack is talking about now is an instrument that we can use to assist the magistrates in determining the amount, or if any, bond a person should be assigned.
Very good. Thank you.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously.
Item number 2 is an item in regards to...
You'd already voted.
Really?
Yes, sir.
Okay.
I didn't forget you. Go ahead, Mr. Beecham.
Item number 2, an item in regards to bid 2020-095. This was a new annual contract for computer accessories, peripherals, and other miscellaneous hardware that we previously purchased off of DIR. And we were rejecting this, recommending this morning we reject all bids and suggesting we rebid with revised specifications. Quite a few problems in the specs, and we just need to clean it up and make it right.
Move for approval.
I'll second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously. And we now need a motion on item 7.
I'll move.
Move approval.
I'll second.
We have a motion and a second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously.
Thank you.
Thank you, Jack. Are there any appointments today? Being none, then you have before you the claims, including the addendum.
Move approval of claims including the addendum.
Second.
We have a motion to second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And the judge votes yes. Motion passes unanimously. Briefing items, Mr. Manius?
Your Honor, members of the court, we have one additional briefing item. This is an update on Census 2020. Mr. Schaffner is here to address the court at this time.
Good morning, or afternoon.
Good afternoon, Judge, Commissioners. After court, we've got hats for everyone, as well as U-Count stickers, some of our memorabilia, and in public outreach items that we have for members of the public once we're able to start interacting more with the public on this issue. So we have a very brief presentation for you this morning. So the census has started. April 1st was the census day and the kickoff to the official count of the census. Hopefully, the Commissioners Court, as well as everyone in the courtroom this morning, has gone ahead and filled out their census. If not, it's my2020census.gov, and you'll be able to see it a couple times in this presentation. Between now and during May, the census will continue to send information out to residences, including the full census survey. So every household, whether or not you have responded, should be receiving a letter from the census, if you have not already, that has the actual questionnaire in it that you can fill out and then send back in. Currently, due to COVID-19, the census has augmented its schedule. So June the 1st is whenever the census is slated to begin to resume field operations, and they have pushed back the deadline for the count from July 31st back to October 31st, and that additional months hopefully will allow for more and better follow-up. So one thing that I wanted to flag for the court is that the Census Bureau and the White House has requested Congress to delay the census. This will specifically delay the date that the census data is given to states for redistricting. So instead of March 31st, 2021, it would be shifted to July 31st, 2021, which would then, the 87th session of the Texas legislature, when they should be handling redistricting, it will have closed because the end of the session sine dies May 31st. So that would require either a special session or a number of new opportunities that could get very interesting. So I wanted to go over response rate. Texas, the national response rate right now is 49.1%. And this is a couple days behind, so the nation has hit the 50% rate as of now. Texas is just a little bit ahead of my notes. It's now at 50.71%. So we are making progress week over week on census response. Tarrant County, this is the Texas County census response rate. So the top 10 were number 8 on our census response rate, which is fantastic. And of the top 6, 5, and 6 counties population, we are the number 1 on the list.
How much did Dallas spend to get ready for their...
They've taken a different approach to reaching out to the communities.
How much did Dallas spend to...
I believe that they've had a number of different contracts with outside entities.
And how much did Dallas spend? But you're going to answer that question one way or another.
The number of $1.9 million.
Okay, how much did we spend?
50 cents.
Not quite.
We better had spent more than that.
We're probably under 100,000 right now. So in Tarrant County also has the top has 3 of the top 10 cities. As of this morning, our self-response rate is 53.1%. So we're making great progress. So a couple of items. So we were partnering with the census on a number of different projects and programs, one of which was we were going to be hosting at no cost to the census enumerator training, which is the folks that would actually be going out into the neighborhoods, taking surveys, and knocking on doors. We were going to be hosting those trainings in county facilities. Because of COVID-19, we had postponed those until census is ready to start that back up. And then we've also delayed the census assistance centers. It's really hard to say. That program and implementation, we're working with a number of partners, identifying libraries, city halls, and other municipal and government facilities across the county that could host or be a place and a resource where individuals of the public who needed help filling out their census could go and receive that help. We've delayed that until, again, after the COVID-19 issue settles down a bit. And then also we've delayed outreach and the various information that we've been pushing out and just retaining that for the time being. Next steps, we're developing...
Let me just stop you for a second and ask this question.
Yep. Yes, sir.
We've got a whole lot of homeless folks who are staying in our shelters right now, including the conviction center. Have we given any thought to taking something down there and registering every one of those we could?
So the Census Bureau is handling individuals who are currently experiencing homelessness. That is in a different, if you will, organizational silo, but I will reach out to the Census Bureau and see if they have had any outreach or if they feel like Tarrant County's the outreach was able to handle, because that started before a lot of the census work was being kicked off. But no, I believe that's a great concept.
But let's take advantage of this.
Absolutely, I'll reach out to them regarding that. We are developing plans to engage and re-engage into hard-to-count areas, given the current social distancing restrictions and some of the restrictions that we have to outreach. So we are developing plans for that, including use of social media and other media options, coordinating messaging with partners, including our legislative and congressional delegations on how we can all work together with those issues, and our municipal partners as well. And then developing additional materials that we can use and distribute as is appropriate during this time. And just last slide, just want to remind everyone it's easy. You can take it online, by phone or mail. It's 10 questions, about 10 minutes. And go to my2020census.gov to fill it out online. You can even do it on your cell phone. So with that, be happy to take any questions.
Yeah, so I have a question about the census outreach activities and the activities, particularly of the enumerators and their field operations. And obviously, we're encouraging social distancing, but what's the census's thought on having people going door to door?
At this time, it's on pause. My understanding is that it's on pause.
Okay.
And that they're waiting until June the 1st to then launch, hopefully be able to launch actual door-to-door enumeration.
Okay. I'd still be concerned even with the June 1st date, especially for, obviously there's a lot that could be changed by that time, but I would imagine our especially vulnerable communities are going to remain vulnerable, those with underlying conditions, 65 plus. So I'd want to make sure that we know and feel good about their plan for face-to-face, door-to-door interactions with folks. Yes. I don't know that you could actually adequately assist someone with completing their census while maintaining 6-foot distance, and then even if the enumerators have a mask, do the others have a mask? So just, yeah.
There are a number of qualifying
right.
factors in the situation. I think those are a number of good questions. We have a status update with the census and our municipal partners
sure.
On this next Monday. And so that'll be some of the issues that I'll bring up.
Great.
That as well as the homelessness question.
And then on a previous slide, you had mentioned the undercount, and I'd like to see some details for what that looks like, where our undercount is in terms of throughout the county.
Yes, ma'am.
So that can help guide us with our continued outreach where we need to have focused efforts to make sure folks get counted. I'm proud of our number, and obviously I would want for us to reach the highest percentage Absolutely. Of completion as possible, regardless of what we're spending or not spending. But I think it's important that, and I'm glad that we're talking about this, that just to remind folks to please complete the census. And even if there's somewhat delayed implications, the delays right. Mean that some of the more things related to redistricting and things like that, even if that's pushed further down the line, it's still important that we complete it so that when the time comes, that we have the highest number possible that reflects our community. So,
absolutely, and we will be working with the census and our municipal partners to start identifying those census tracts and zip codes that do have lower response rates, and try to see if there are ways of tailoring some messaging and some items to those specific areas.
Great.
So we'll be back with more information on that, ma'am.
Very good.
Thanks. Any other questions?
Anything else?
All right. Well, thank you very much.
Thank you. When we get our hats?
We'll leave them here for social distancing purposes.
Anything else, Mr. Mayes?
Yes, I think you have one additional person that wanted to speak under
good point.
Public comments.
Thank you for reminding me. Okay, at this time I'm going to be calling Cindy Mata. I hope. Maybe not. Just a second, we'll try this again.
Hello?
Yes, Cindy?
Yes, this is Cindy.
This is Judge Whitley, and you had called in wishing to speak regarding the 287G subject matter. And so please repeat your name and your address, and then you have 3 minutes to make any comments you wish to make.
Okay, thank you. My name is Cindy. I reside in zip code 76115, precinct 4. I am calling today on behalf of ICE Head of Terran to urge you to refuse to honor ICE detainers and in the collaboration with ICE through the voluntary 287G agreement. When immigration detainers are set in place, there's an existing increase of racial profiling. Officials use a person's race or national origin as a form of identification to place an ICE hold on an individual. The impact of this action on our community results in fear and a lack of trust between local law enforcement and our community's public safety. This agreement leads to irreversible damage through family separation and the continuous distrust and anxiety felt by our community. In this unprecedented time, spending local resources on federal immigration enforcement activities, such as detaining individuals in local custody for ICE instead of efforts to limit the spread of COVID-19, is simply unnecessary, inhumane, and unsafe. There are currently 27 confirmed COVID-19 cases at Prairie Land Detention Center in Johnson County. It is imperative that we prioritize community needs and the current public health crisis over cooperating with ICE and honoring immigration holds. COVID-19 is more dangerous in prisons and detention centers where people cannot adequately practice CDC guidelines to reduce the risk of exposure to incarcerated people and staff. We are here once again to ask you to terminate the voluntary 287G agreement and refuse to honor ICE holds in Tarrant County. In addition to the impact on public safety, there is also a huge flaw to this program. ICE does not require data to be collected or measured. Without the use of any objective data, we cannot determine the impact of the program, which according to ICE is meant to enhance the safety and security of communities. However, immigrant communities and several allies have shown evidence of the long-lasting impact that this program has on our community members. We have evidence of the discretionary abuse of power and racial profiling that has been used through the program, Maricopa County being a clear example of that. Over the course of time, we have also seen the impact of Sheriff Bill Wayborn remarks to the contribution of our community's concerns and anxiety. His statement of "these drugs will run over your children and will run over my children" at the White House is an example of the responsibility of Sheriff Bill Wayborn's actions to the perpetuation of harmful rhetoric to an already vulnerable community. The anxiety that the agreement has brought to Tarrant County is evidence that our community does not feel safe. Finally, the 287G agreement suffers from poor oversight and lack of transparency from Sheriff Bill Wayborn's department. The information presented last year was unsatisfactory, and yet you continue the program without considering all the evidence. We cannot continue to divert our local resources to a program that creates harm. The impact of this agreement has already created a detrimental impact with long-lasting consequences. It would be irresponsible to continue to allow it to harm our Tarrant County community.
Thank you very much for your comments. With that, well, I'd say have a good afternoon. Thank you.
All right. Thank you.
Your Honor, that's all we have at this time.
If there being no further business, we're adjourned.